How does estrogen therapy affect osteoblasts for osteoporosis? Have you ever wondered how estrogen therapy impacts the cells that build our bones? Let's dive into the fascinating world of osteoblasts and how estrogen plays a crucial role in managing osteoporosis. Osteoblasts are the cells responsible for forming new bone. They work in harmony with osteoclasts, the cells that break down bone, to maintain a healthy balance in our skeletal system. Estrogen is key in regulating this balance, especially in postmenopausal women who are at higher risk for osteoporosis. Estrogen therapy influences osteoblasts primarily by modulating their activity and the signaling environment that governs bone remodeling. When estrogen binds to its receptors on osteoblasts, it helps maintain bone density by promoting a balance between bone formation and resorption. One of the critical ways estrogen does this is by reducing the production of a protein called RANKL. RANKL stimulates osteoclast formation and activity, so by decreasing RANKL, estrogen helps suppress the bone resorption process. But that's not all. Estrogen also increases the production of another important molecule called osteoprotegerin. Osteoprotegerin acts like a decoy, binding to RANKL and preventing it from activating osteoclasts. This shift in the balance between RANKL and osteoprotegerin favors reduced bone resorption and supports bone formation. Moreover, estrogen promotes the survival and function of osteoblasts, enhancing their ability to form new bone. It may even stimulate the proliferation and differentiation of these cells, contributing to bone formation. Estrogen also influences osteoblasts to produce factors like transforming growth factor beta, which promotes the programmed cell death of osteoclasts, further reducing bone breakdown. Now, let's consider what happens when estrogen levels drop, such as during menopause. This loss leads to increased RANKL expression by osteoblasts and bone lining cells, along with elevated inflammatory cytokines. This imbalance results in increased osteoclast activation and excessive bone resorption, leading to the characteristic bone density loss seen in osteoporosis. Estrogen therapy aims to restore the regulatory effects that estrogen has on osteoblasts. It decreases the expression of RANKL, increases osteoprotegerin production, enhances osteoblast survival, and modulates inflammatory factors that promote bone resorption. By doing so, estrogen therapy helps rebalance bone remodeling, favoring bone formation over resorption and slowing, or even reversing bone loss in osteoporosis. It is important to note that while estrogen therapy can be effective in reducing bone loss and fracture risk, it must be prescribed and monitored by healthcare professionals. Each individual's situation is unique, and personalized medical advice is essential to determine if estrogen therapy is the right choice for managing osteoporosis. Understanding the role of estrogen in bone health can empower individuals to make informed decisions about their treatment options.